Hello everyone and welcome back to our PLAB 2 CPS course here at Dr. Coaches. Today we're going to talk about combined history and physical examination stations. By now you're probably thinking, well, it's very straightforward, I should do the same thing I would normally do in history taking, and you're correct. The only difference is if we break down the station in the 8 minutes, the first 30 seconds should be used to introduce yourself to the examiner and to the patient. The following 2.5 minutes should be used taking a focus history using your P3 math dosa. That leaves you with roughly about 3 minutes to perform your focus physical examination, and then 2 minutes to talk about management with your patient or an examiner. When you reach the point of performing examination, which will usually be after doing eyes, you'll ask for verbal consent. To give you an example, John, would I be able to examine your chest? This would involve me looking, listening and feeling of your chest, and it will require for you to be exposed from the waist up. Will that be okay? And the patient will say yes, and that's verbal consent. Once that happens, you go and do it. Now, it's very important to know that if you examine a mannequin, you should always speak to the actor or actress. And if you uncover a mannequin, you need to cover it back up. Remember, it's very important that you follow your bedside manners as you would normally do on a day-to-day basis in your clinical practice. Once you completed the examination, you can say, thank you very much, John, you can get dressed now. Or if this is a mannequin, you can cover them back up. Then you sit down and then you move on to your management. Based on what you told me after examining you, I think X, Y, Z, and you do your management. And that's the end of the station. Now there's some clues you can find to know whether you are going to encounter a physical examination station or not. In the task, they might tell you, perform relevant examination. Or they can say, assess the patient. When they use the term assess, assessment means also physical examination. If those are not on the task, as soon as you walk in, there's some tips that can give away that this is a physical examination station. One of them is that there might be an actor wearing a hospital gown, and if that's not the case, there might be a mannequin covered by a hospital gown. So as soon as you walk in, look around, be aware of your surroundings, and then you'll be able to see whether it's a mannequin or the patient is actually wearing a hospital gown. If that's the case, you know you're likely to be performing examination. If, let's say, the patient is not wearing a hospital gown, but there is no mannequin, but they're wearing shorts, and the problem is that they have a joint problem, where there is a knee, the ankle, the elbows, or the shoulder, that means that that is something that you can examine without the need of taking the clothes off. There are very common sessions you can encounter, one more than others. The most common examination sessions that you will encounter in PLAB CPSA are testicular examination, rectal examination, vaginal examination, breast examination, abdominal examination, ear examination, and eye examination. These examinations tend to be done on a mannequin, so one of the clues will be that we are a mannequin. Joint examinations are usually done on a person, so you're likely to have a patient wearing a hospital gown or shorts. A very good resource to understand how physical examinations are performed in the UK is reading the Oxford Handbook of Clinical Medicine. There you'll find all the steps on how to perform the examination. I hope that was very helpful, a very brief introduction to physical examination stations and how you need to approach them. If you have any questions, you can text us on Telegram, email us, or ask any of these questions during the first 30 minutes of the practice sessions.